evening. Good to have you with us in this edition of the Urban Debate. We have so many announcements and so much conversation taking place around vaccine for coronavirus. So tonight we are going to put the spotlight and spend the next 60 minutes only talking about the COVID vaccine, various trials that are underway. What is it that India needs to do? How prepared are we? What is the vaccine that will be best suited for us? Today, in a meeting with the chief ministers, Prime Minister Modi also asked the states to start preparing, start looking into a distribution program, start preparing their cold storage facilities. There is a larger warning that's also coming from the central government about the possible side effects of the vaccine and how the states need to factor that in and keep themselves ready for if there are any side effects. Also, this means there has to be exhaustive tracking of when the vaccination begins, of how it is impacting our people. There are also lots of misconceptions about the COVID vaccine. Suffice to say, it's not going to be an overnight process even if the world finds one vaccine that can be used. Suffice to say that our government will have to look at various options and decide which one is the best for us. Our government will also have to decide whether we want to go ahead with more than one vaccines. We will then have to track how it impacts Indians when we start giving it to people in our country. Keep in mind, viewers, that usually the trials for any vaccine, for any disease or infection, go on for years together. The hunt for COVID vaccine was fast-tracked. The trials were fast-tracked. The number of people involved who were taken in as volunteers were much smaller than what one would imagine or one has seen in other cases. And no vaccine is 100% active and effective. So what should be the precautions? What should be the specific points that we should have in our minds? What kind of caution do we need to show as we select a vaccine and start a mass immunization program for our country? To help us understand all of this, we've got an expert panel lined up for you, and we will take it in multiple angles. The first angle is going to be about the warning about the side effects. But before we go to all of that, quickly let's go across to Aarti. And she will be explaining to us the big takeaways from the meeting that's taken place. Let's also say good evening Dr. Anees Sinha, Associate Professor of IIPH Gandhinagar. He's worked for WHO and UNDP for various vaccines and immunization programs. Dr. Sanjay Pujari, Director for Institute of Infectious Diseases, also a member of the National Task Force for COVID. Dr. Chandrakant Lahiriya, Public Policy and Health Systems Expert, co-author of an upcoming book, Till We Win, which is India's fight against COVID-19 pandemic. And Dr. Shekhar Mande, DG for CSIR, also with us this evening. Thank you so much to all of you for joining us right now. Let me just quickly begin with Dr. Pujari. Dr. Pujari, this warning that's coming from the center to the states about the possible side effects, what essentially are we going to be watching out for? What does it mean?
Yeah, so good evening. As we know, vaccines are a very important public health tool, and the most important difference between various other vaccines and the COVID-19 vaccine, as you already mentioned, is the fast tracking that has happened, which has two immediate consequences. One is obviously a small number of individuals have been participating in the trials. So the amount of adverse events which may be rare, the side effects which may be rare, may not be really picked up in small trials. The second aspect also is that there are multiple platforms that are being simultaneously rolled out in studies, and the duration of monitoring for the effect and the side effects has been very less. So, for example, a vaccine that is supposed to be in the US going to get an emergency use authorization. The criteria is that you should not have severe adverse events in an observation period of about 8 weeks since giving the first dose. So as you see here, these are the limitations. And as for any other vaccine, we have what is called as a very rigorous surveillance when the vaccine is actually rolled out in the community as a program. And this surveillance, often called as a phase 4 study, looks at side effects in addition to efficacy. And when it goes into the community, we are actually talking about effectiveness of a vaccine and not necessarily efficacy, because in clinical trials, it is a controlled environment. In community, there is not really a controlled environment in which you're going to roll it out. So the observation, the surveillance has to be very strict. There are a larger number of individuals, and rarer side effects may come up, which needs to be immediately identified, reported, dealt with, and studied in detail, so that if there is a possibility to avoid these adverse events, that can be really done. So this is an essential component of any program for rolling out any vaccine. And that is true for COVID vaccine as well, because this is a new vaccine. The platforms are new as well. We never had any platform like an mRNA vaccine for any disease, any infectious disease. And so it's true for viral vector vaccine. So rarer side effects may come up in phase 4 trial and there are examples in the past for rotavirus vaccine, a particular candidate, when was found safe in trials, but when subsequently it was rolled out in community, they had some adverse events of intestinal disease in kids. So based on that historical evidence, it's very important that as we roll it out, and this is very important for faith of the public in vaccine, because if the public sees that the vaccine is safe, then obviously there will be an increased uptake for the use of vaccine.
Okay, fair enough. So how long, I mean, the one question that comes to our mind is, for how long, Dr. Shekhar, will we have to track, the response that people are showing once we begin with the vaccine? I know, I mean, ideally, I would have started off with which vaccine is best suited for us and if we are ready with our storage and transport and logistics. But because this warning has come today, and this was an important part that was highlighted, we are beginning with this. So if you can shed some light on for how long will we have to track people's response to the vaccine, and how will we do that? Do we have a system in place?
Yeah, the system in place is all over the world. Whichever country does clinical trials, even after giving approvals, not only emergency approvals, but even after giving final approvals, these kind of things are tracked for a very long time. Any medicine or any vaccine, generally the effects are tracked for many months or sometimes years, just to see that whether there are any adverse events that are getting there. And any adverse events have to be recorded, and a reason has to be ascribed is because of the medicine or the vaccine that is given. And if so, then a very rational view is to be taken. Why has that happened? And at every stage, the regulators around the world do what is called as the risk-benefit analysis. How many people are getting adverse this thing, and whether we are getting the benefit outweighs the risk that are being given to us, risk which are putting some few people at risk of that particular one. So these kind of things are very routine around the world for regulators to look at.
Yes, but so essentially, Dr. Anish Sinha, maybe you can come into this. This kind of a mass immunization program is going to be very different from what we've seen ever in terms of the size and the scale and the speed. Just like this trials were fast-tracked, Dr. Sinha, even the vaccination program is expected to be fast-tracked as much as is possible, depending on how fast we can manufacture these vaccines. So then will this tracking become difficult? Dr. Sinha, I think you're on mute. You'll have to unmute yourself.
Thanks for the reminder. Regarding this, we as a country are at many advantages as far as mass immunization programs are concerned. We actually have the world's largest universal immunization program. We have done so many of pulse polio campaigns, immunizing over 18 crore children in each and every campaigns. We recently, 3-4 years back, we had a measles rubella campaign covering a huge, almost 20% of the population. So these are the advantages. Now, this mass immunization program, whenever any new vaccine comes or there is a mass immunization program, there is a rigorous training of the entire cadre of health providers. And in that, this adverse event following immunization is taken care, it is given a due emphasis to ensure that if any such events if come up, they are picked as early as possible and a proper investigation is done. The systems are there at the state, district, and national levels for the adverse events following immunization. Surveillance is there to ensure and find out if there are any serious things, and then to take a decision based on the outcomes. But looking at the results which are available till now of the vaccines like Oxford or Pfizer or Moderna, none of them has reported any serious events as of now. They are very mild ones with rash and or headaches and all, and that too short-lived. But still, this surveillance, the AFI surveillance post implementation will be very needed and need to be a very robust system for that. And the mass program will not be a hurdle as such because there will be a rigorous training of the cadres. So that's all.
Okay, so you're saying that the mass program will not be a hurdle, but of course, large-scale training will be required. Before I move on to the second angle, very quickly, let me also bring in the views of Dr. Leheria as well on this. Dr. Leheria, yes, perhaps if we compare ourselves to many of the Western worlds, we still have an active mass immunization setup. But when it comes to the COVID vaccine, and we say that we want to try and give it to as many people as possible in the first year itself. Now, if we have to track how people are responding and if there are any side effects, electronically, are we equipped to do that?
So Tanvi, the key is that safety of vaccine is a concern of everyone, be it a vaccine manufacturer, the national regulatory authorities which approve the vaccine, and public also. What we also know that vaccines are there for more than 200 years ago, or for more than 200 years, and vaccines are as safe as possible, which is possible only because the manufacturers follow some guidelines and they keep tracking those minor side effect or serious side effect, and regulators keep looking at those aspects. What we need to convey to the people that safety of the vaccine is one particular criteria which is followed at every stage of vaccine clinical trials, like phase 1, phase 2, phase 3. So in all phases of clinical trial for vaccine, the safety is always checked, but efficacy is seen largely in phase 3 only. And as earlier speaker has spoken that even when vaccine is licensed, so the regulator definitely looks at are there any major or minor side effect. If there are major side effect or serious side effect, the vaccine is unlikely to be licensed. So only minor side effects are considered because the benefit of vaccinating against the minor side effect is very high. So vaccines are beneficial, then those are licensed. And other speakers have also highlighted that there is something called once vaccine is licensed and administered to millions of people, that post-marketing surveillance as part of the country's regulatory mechanism. Even when a vaccine is licensed in that setting, and the manufacturer need to report initially for 2 years, and it depends upon different country setup and regulatory requirement that what are the side effects which have been reported. So it's not that once vaccine is licensed, it ends there. It's an ongoing process. So to summarize my point, I would say that safety is an important concern. Vaccines are as safe as possible. Millions and billions of doses of vaccines are given, especially coming to COVID-19 vaccine. While we are hearing a lot that these vaccines have been fast-tracked, but we are also assured, and we keep hearing that as and when there was a minor or any serious side effect was reported, some of the trials were halted, and those side effects were examined and resumed only when the Data Safety Monitoring Board found that these are safe. So even though it's being kind of fast-tracked, but we can be reasonably assured that safety is being considered. So
Well,
I'm fairly confident that this will work well, and there are mechanisms which all countries, including India, have to assure the safety of the vaccines.
okay, no, I get the point that you're making, that, in a few of these cases, at least we know. And I will emphasize on this point, because unlike Dr. Lahiria, I'm a bit of more of a skeptic, and I would say that we know in a few cases there was some kind of adverse impacts that was visible, and they halted and they checked. But we also know that the number of people in all of these trials was fairly small in comparison to the earlier ones. So, and of course, that process of research will continue for years. Maybe I would agree that it's not to say that, well, we don't know if this vaccine will start killing people tomorrow, and so that from that aspect it is safe. But to what extent will it have an impact or side effects? A lot more research may have to be done. May I just move to the second aspect, and we'll talk a little bit more about safety even in this. For example, let's take what AstraZeneca has announced. Now, and most of these companies haven't given the detailed numbers and research yet, or the data that they've recorded. It's all announcements based on some interim analysis that they have done. So, that's something that we have to watch out for. But AstraZeneca has actually said that they did two different dosage regimes. They did two different styles of dosages that were given to the volunteers, and both of them showed different kind of efficacy. So in one, the efficacy was much lower in the 60s. In the other one, it was much higher, in the about 90%. And so on an average, they say that the efficacy shown would be around 70%. But if any of our experts can explain to us the two different doses and how the science community is really looking at it. Dr. Shekhar Mande, if I can start with you, because there's a full dose and there is a half dose. What does that mean?
So this is very interesting. So what happened was they were conducting trials in Brazil and in UK, and they actually intended to give full dose in both the times, but it's appearing from media reports that they actually made a mistake in the first one and they gave only half the dose. That's actually appearing from media reports. I'm not saying it's a confirmed news, but it so turns out that the first dose giving as a half dose and the second one 28 days later as a full dose, that actually appears to give a much better protection. Now that's what all the media reports say. Now, as far as the science is concerned, it's not clear why that is so, but a number of hypotheses can be proposed why giving the first one as half the dose and the second one as the full dose would give better protection than giving both of them as the full dose. So science is not very clear, but there are a few hypotheses which have emerged, and I'm sure entire scientific community would be very eager to address this particular issue because it's a very exciting
right. Now, and I would highlight and emphasize on the same question that you did, that these are some reports. Perhaps, Dr. Lahiria, because even experts are not able to understand why was this attempted to begin with?
Well, so as Dr. Shekhar mentioned, that this was not by the design, and what is appearing in media, that serendipity that it happened that some of the participants in UK were given half dose, but effect was found far higher than the full dose which was originally planned. And number of such participants is very small. I agree that this is something which need to be further examined, and there are hypotheses which investigators have given that the vaccines works on the principle of priming and boosting. So in the priming, you give first dose, so immune system start working, and the moment it's really ready to react, you give a second dose, which is a boosting dose. We give at 4 weeks in this in this case. However, let's forget this for a while. This is an important investigation, an important one, but even without thinking of fractional dose, small dose or full dose, overall efficacy of vaccine for the entire trial is 70%, which is fairly good, which is far bigger than what was originally planned at 50%. So that itself is promising. And it happens in many of the trials, though this was not by design in this trial, that the participants are given different dosing regimen, which include different dose, but also different schedules also. But in this case, it happens by serendipity, as they say in the science, penicillin was discovered by the phenomena called serendipity. So we have
Okay.
learned here, but 70% is a good efficacy by any standard for the first generation vaccine.
All right. Since we are talking about the AstraZeneca Oxford vaccine, Dr. Pujari, your views on what is obviously right now available to us as information about this specific vaccine, and many experts believe that this perhaps could be the best suited for India. We are already involved in it. It would be faster for us as well. And if it's a half dose, it means they can manufacture more and manufacture it quickly for more people.
Yeah, so I think we should be a little cautious because these are press releases which have come. We have not seen the whole data. From the first press release, it looks like there were 131 cases which were seen in 11,000 patients, subjects. They're not patients, they're normal individuals. Out of which this low-high dose schedule was given to around 3,000 patients. And another remaining 8,000 patients received the full dose schedule of this vaccine. So there may be a lot of reasons why you see a differential response. The most important thing in science is not just a point estimate, but what we call as a confidence interval around that point estimate. So we don't know the real numbers, so we don't really can say that this vaccine has a particular kind of an effect, but looks like averaging out, it has an excellent kind of an efficacy around 70% with the low full schedule of giving this vaccine over a period of 2 doses. Having said that, I think it's actually advantageous if you believe that this is something which is working, then it is advantageous in the sense that you just need to manufacture, with the same kind of manufacturing, you can vaccinate more number of people. Obviously, the cost will go down if the first dose is low kind of a thing. But there are other advantages also in the Oxford press release that they gave. And one of the advantages was it reduced severe illness. So even if you get infected, if you are vaccinated, you would not probably have severe illness. The second interesting observation, which has not been done in other vaccine candidates, is the prevalence or incidence of asymptomatic infection. So it was lower in the vaccine group as compared to the control, though we don't know the numbers. But what it essentially means is that if you are able to prevent asymptomatic infections, you're going to prevent transmission. So this is a first evidence that a vaccine can really prevent further transmission. If it can prevent an asymptomatic infection. We don't know about the efficacy for the elderly population. It's not mentioned in this study, but in the phase 2 earlier study, which is actually published, they demonstrated that it is quite effective in the elderly population. So I think this is perhaps we need to, of course, wait for the final results and look at the whole data very, very critically. But it is something which is easy to produce. We already have a manufacturer who has risked a lot of investment in trying to fast track this, already stockpiling the doses which are ready as soon as the final results are available to be distributed to high-risk groups and to healthcare workers in the first phase of the vaccine rollout. So it's easy to produce and distribute. And most importantly, as compared to the Pfizer or the Moderna vaccine, which are basically mRNA vaccines, you have this vaccine which can be having a lower cold chain requirement of 2 to 8 degrees, while those mRNA vaccines need minus 80 degrees, which perhaps is not possible. So current vaccination program in India is already maintaining the 2 to 8 degrees as part of the mass immunization program. So this needs to be integrated into that. Obviously, the scale and the reach has to be wider, because our immunization program has predominantly focused on pregnant ladies and infants, kids. Adult vaccination is something which unfortunately in India has not been taken up. So this is actually a very good opportunity to scale up adult vaccination starting with COVID-19 vaccine.
Okay, a good opportunity to scale up is a good, also an optimistic way of looking at the current situation. And in times of a pandemic and the way this year has been, I think we do need a lot of that optimism. Now, let's also move on to the angle number 3. And I'm going to take off from what Dr. Pujari said about the Oxford AstraZeneca vaccine and the points that he highlighted, and ask a question to our experts which vaccine they believe is best suited for Indians. And this may be a tricky one, but I would like some amount of you all should be taking a stand and saying that which one you think is the best suited for us. But before we do that, and this will give you some time to think as well, let me just quickly go across to Aarti Subramaniam as well. Aarti is joining us from the newsroom. And as we talk about vaccines, she's also got, a list of pointers and takeaways from the conversations that our leadership had today. Prime Minister Modi met with all the states and the chief ministers, again, about preparation, logistics, the way the distribution and vaccination will be done, and how states should prepare for that. That essentially was the big focus, but Aarti has the details. Aarti?
Well, that's right, Tanvi. Now it's just a question of when and not whether we're going to get a vaccine at all. And the Prime Minister has been leading this charge in many ways. He's been holding a number of meetings with chief ministers of various states, and he's been doing that regularly, where there's been an honest exchange of ideas and opinions. So let's just take you through some of the takeaways of the main, and this is the latest round of the meeting that has happened. The Prime Minister has said in this round, of course, that the one major takeaway and the large part of the discussion in this focused on the vaccine itself and the distribution of vaccine and how that was going to be done. The first takeaway was that he has said states to start planning on cold storage facilities. Now, it's an extremely crucial part of the vaccine, and as you were just discussing right now, whether or not we have the capacity to distribute the vaccine to ensure that it reaches each and every individual of this country, given our climatic conditions, given our demographic challenges, giving our geographical challenges. Cold storage facilities are going to be very crucial to this, and he said states need to start planning and need to start focusing and thinking about this aspect. The next big takeaway that he said was a prioritization of the vaccine itself is also going to be largely for healthcare workers. First of all, this information was actually came through the Gujarat Chief Minister, who said that the Prime Minister had emphasized that in the first stage, the vaccine would be given to frontline healthcare workers, in the second stage to police personnel and sanitation workers, and then it's to those who are above the age of 50, to comorbidities, those who have comorbidities in the fourth stage. So basically, we also need to start planning, of course, on who gets the vaccine first and at what stage. And as of now, the priority clearly seems to be, and rightly so, on our frontline workers who have been putting their own lives at risk. The third big takeaway, the Prime Minister has also indicated in this meeting that there should not be politics over the vaccine and the time when the vaccine comes. This is an issue that should be left solely to scientists to take a decision on. Ironically, his own party was the one that mentioned vaccines as part of its manifesto to giving it free. But I think the Prime Minister's comments also largely came on when that vaccine is going to be available in the market. It's something that should be completely separated from politics. The fourth big takeaway was that the aim of essentially at the end of the day was that to ensure that each and every Indian citizen has access to the vaccine, and that is the ultimate goal that states have to work towards in conjunction with the center. And finally, the vaccine to be given to the citizens will be as per approved standards. There is going to be no half-baked approach there. There's going to be no cutting of corners there. We're going to wait for the vaccine, and we're going to figure out in the interim how to ensure that it reaches every citizen of this country.
All right, Aarti, thanks so much for bringing those details and highlighting the takeaways from the conversations and the way the states should be preparing the kind of work that has started. Thanks, Aarti, for that. So let's take it across to our panelists. And as I do that, I just want to also highlight that there are 5 vaccine trials where India has partnered, and then there are others, especially the ones like Pfizer and Moderna, which have made announcements about significant progress. Which one is the best for us? Dr. Shekhar, let's begin with you, because many experts say it's not necessarily about the first one, but the right one.
Correct. So if we actually ask a philosophical question that what makes an ideal vaccine, so it has number of things that we can consider. It should protect 100% of the people. It should be easy to store, and it should be easy to transport. It should be easy to administer. It should not have any adverse effects, and so on and so forth. This kind of thing would be an ideal vaccine. But as we all reconcile that no vaccine is ever ideal vaccine, right? I mean, all of these to meet together is very difficult. The closest to coming to ideal vaccines are things like smallpox vaccine and all, which has actually helped us eradicate smallpox completely. Now, in the current scenario, the number of reports that are emerging is that the Pfizer and Moderna vaccines, they give something like 95% efficacy. Now, there is a subtle difference between efficacy and effectiveness that will not go into this discussion, slightly subtle difference in the two. But nonetheless, Pfizer and Moderna, the Pfizer thing, the report suggests that it has to be stored at -70, while Moderna claims that it has to be stored and transported at -20. So that poses its own challenges. While Oxford and AstraZeneca vaccine, which also the Serum Institute of India has partnered with, they seem to suggest that it is about 2 to 8 degrees. So in the current scenario, as far as the logistics are concerned, 2 to 8 at least appears to be better for us. But a call to be taken is that which is more effective, which is not. So actually, we'll have to actually weigh in number of different options. That if the Moderna actually seems to be very effective eventually, and Oxford and AstraZeneca is slightly more, less effective, but nonetheless easier to transport and all, that will be the choice that people will have to make. So let people have all the choices available, and people could choose any among them.
That's an interesting thought, Dr. Laeria, that people have the choice what kind of vaccine they want to go for. Would you agree with that kind of a setup?
So there are always some standard guidelines and approaches which are followed to select the most appropriate vaccine for a particular setup. That's one. Second is that it also depends upon at which stage we are asking this question. So now when we are talking, there are 3 very promising vaccines which are available. I would say that there are 3 criteria which will be considered or should be considered by policymakers. One is the efficacy. So we are hearing that some vaccines are 95% efficacious and other are 70%. Second criteria, along with the efficacy, we need to talk about logistics requirement, which we heard that what kind of cold chain it will require, how it will be administered. And third criteria, which a policymaker would be concerned or interested into, would be the cost of those vaccines. So when we put 3 things together, efficacy, logistic requirement, and cost, and that's what will determine the right vaccine for the people. So you cannot go for a very high efficacy vaccine if it's not affordable and you have to vaccinate 500 million people. So in this background, if there was no choice of a low cost vaccine, which is not the case now, we know the cost difference between 2 vaccines which are coming from US setup and other vaccine of AstraZeneca, Oxford, which will be manufactured in India, is very huge. So it seems like the most useful vaccine for India would be the one which is the lowest cost, can be stored at the existing cold chain capacity of 2 to 8 degrees Celsius, and can be affordable in the long run also. So it's an easy choice as of now, but none of these vaccines are licensed, and we cannot wait indefinitely. So there could be a scenario when there is a delay in the licensing of a vaccine which is low cost, then we probably have to go for an expensive vaccine which need to be stored in those setups. So answer is not that easy, but it depends upon context. And I'm really excited, and all of us are very hopeful that we will have a vaccine which is a mass production in the large quantity, low cost, affordable, and not only affordable in the next 3 months, affordable in the long run to vaccinate 1.38 billion people.
Right. Okay, just want to quickly revisit the 5 different candidates that our government is actually banking more on. And last week when announcements were coming in from Pfizer and Moderna, especially the mRNA vaccines, which require colder temperatures, the ICMR and the government responded by saying, yeah, we are tracking those and hopeful, but we are also more hopeful about these other 5 candidates. Now, this include 3 which are already in advanced stages of trials. AstraZeneca that we have spoken about, they are doing it in partnership with the Serum Institute in Pune. And then there is the Bharat Biotech's Covaxin, which is also in phase 3. Then the Russian vaccine, Sputnik 5, which is also partnered with Dr. Reddy's lab, that vaccine is here already for the next phase of trials to be conducted here in India. So these are the 3 key ones we are looking at. Then there is Cadilla's candidate as well as Biological E. These are the other 2 ones, a little behind versus the other 3, but 5 of these. Dr. Anish Sinha, do you think these are more suitable for us than the mRNA ones?
For our country, if the earlier speakers have said, like we have to consider basically 3 things mainly. the efficacy, the cost of immunizing such a huge population, and the logistics arrangement. So by all this, the Pfizer, Moderna, because they require ultra cold temperatures for storage, transport, is not very feasible for low middle income countries like ours. However, we have a strong, robust cold chain system in immunization for storing vaccines and transporting at +2 to +8. So any vaccine, if it can be stored safely and transported in +2 to +8, will be more suitable for us. Now, one more important point I like to highlight here, efficacy is not the only thing, because these are all efficacies which we are looking at 92%, 94%, 90%, 70%. These are in highly controlled environment. Now, when they come out in the actual implementation in the field, maybe that they may not be that different among the effectiveness, because we will not be able to provide such a huge ultra cold temperatures for those two vaccines. So efficacy is one thing. So the coverage is equally important. Even if it's a 70% efficacy, and if we go for a good coverage of the vaccine, immunizing each and every individual, we will be able to win over this pandemic. So regarding the vaccines, which you said, other ones which are being developed in our country, we can the Oxford is very promising, and they have already started manufacturing it. 40 million doses are already manufactured. By next month or by January, they are ready with the 100 million doses, and they may also go for the emergency use authorization, and if granted, may supply also the initial. And they have a monthly plan of some 100 million doses on a monthly basis. They are ready to, they can be manufactured. Now, the other vaccines like the Covaxin, which is ICMR's National Institute of Virology and Bharat Biotech, they have also entered into the third phase of trials. And though the results are not available as of now, however, I think that they will be also very close to this Oxford vaccine, maybe. And the others are also. So it's not that it's just a beginning. Like, we may go with one vaccine in the beginning, but by March, April, May, June, these vaccines results may come up and maybe equal, or at times maybe better also. So we may go for different types of vaccines, procuring more than one type of vaccine for immunizing such a huge population. So going forward, it may not be for only one company or the one type of vaccine. We may go for a multiple type as the time comes, and the necessity will be there.
Yes, in fact, that's a very interesting point that you raised, saying that we don't have to stick to one. We give the options. For example, Dr. Pujari, there may be one which is more affordable, easily, can easily be manufactured and put out there, or in a fast manner, that we go with. But as time progresses and research continues, there could be another one which is actually more effective, costs a little more, but that choice can be brought in later. Is that a possibility?
Yeah, so you see, science of vaccinology is progressing very fast. So trying to adapt a program based on rapid change in scientific evidence can be quite challenging. It's not easy to stop rolling out a particular candidate and then subsequently immediately moving to another candidate. So this needs to be a little long-term planning, and there are many unknowns which are there. First of all, we don't know what's the duration of protection of any of these platforms, any of these candidate vaccines. Do we need to vaccinate these individuals annually, or is it just a one-shot vaccine? We don't know answers for this. So once we get answers for this, we need to have a program which tries to adapt to this. In trying to decide between these 5 candidates that you mentioned, apart from efficacy, and of course, efficacy amongst candidates can't be compared. You can't compare apple and oranges. These are different candidates. They work in different populations. You need to have really trials which are ethnically done in our country, and to study what are the adverse events or the efficacy effectiveness of this vaccine. The second, apart from the 3 things mentioned by the panelists, I think safety is one of the important issues. You can't have a highly effective vaccine if it's unsafe. The risk-benefit ratio is not really there. So safety has to be carefully monitored and factored into selection of what candidate vaccine. And also, interestingly, how many doses? Because we increase vaccine program to giving 2 doses, it kinds of complicates. But if you have a vaccine, for example, the Russian vaccine Sputnik, they have claimed that it's a single dose vaccine, and there's another Johnson and Johnson vaccine also is a single dose vaccine. So we need to even factor that if a single dose of vaccine is as effective as a 2-dose vaccine, perhaps you can also look at that option. But with all these caveats, I would really be waiting. Of course, this is optimistic. I'm very pleased that we have so much good results.
Yeah.
We need to really see the hard data. We need to see the hard data. We need to see the published data, and then really make a final conclusion about what we need to roll out.
Well, and we can never emphasize on that aspect enough. Experts from the science community highlighting that we need to see the detailed data. Right now, what we have more is press releases and statements from the companies themselves of what they have found and how great their product really works and what's its efficacy level. But they will have to, when they go in for the approvals, when they apply for the approvals, and then when they seek a government's permission to start selling this in the market or to governments, then they will have to give exhaustive data, and they will also have to make that public. So let's move on to the next conversation point. We briefly touched upon it, but very quickly I want, and Dr. Sinha, maybe you can start off more with it. You said that because we have an existing mass immunization program, we already have a head start in terms of storage facilities and transport and logistics. But will we have to add to it, and how much? We know that the government has put out a tender for companies to come and participate as far as the storage planning is concerned. What is the scale of this infrastructure that we are talking about?
Basically, a very good question and a very relevant, because the scale is going to be a huge, which we have not done in the past. But we have something which we have to build on that, like our immunization system, which we have world's largest, probably in terms of number of doses that we administer, and it's a universal immunization program. So we have some the cold chain equipments, the system is that the vaccines are stored at +2 to +8 degree, and that is why we are banking more upon the vaccines which can be stored at +2 to +8 degree. Nationwide, if you look at the country's immunization supply chain system, right from the manufacturers, we have the government medical stores, depots, the district, the state, and the last cold chain points. So in all, these are over 27,000 plus cold chain points which are available, and they are equipped with the cold chain equipment. But what is their capacity? Generally, they have a capacity to cater to our routine immunization program, which are generally targeted to infants and the pregnant women. So the system is there, but the volumes need to be enhanced. And there are some efforts being made from the government to enhance these volumes to procuring more cold chain equipments. And so that will add to it. The good thing is we also have a electronic vaccine intelligence network, which is developed in the recent time, last 3-4 years in the entire country, barring a few states which are under the process of implementation. It's electronic vaccine intelligence network. So this actually is a digitalized way of looking at the vaccines transport, the vaccine storage, the quantities, and the temperature. They are equipped with the remote temperature loggers. So the temperatures can be monitored. And there is a standard dashboards for it. So this is being leveraged for COVID also. They are going to readjust it for COVID vaccine. They're going to call it as a COVID Vaccine Intelligence Network.
Right.
And so they will be using this platform again for this. And also one more addition will be there. The beneficiary side of the people, like technology, will be used to ensure that all gets the vaccine, and the priority gets the vaccine first. So this is the entire cold chain mechanism, and the system need to be scaled up for this. And last point to this, like the vaccine will not be supplied for 1 billion or over 1 billion population at a time. It will always be in a staggered manner. And there will be utilization also. So we may not require a cold chain system which needs for this whole 1 billion population, but definitely we need a And we need to surge the capacity of the cold chain mechanism. But then again, it will be procured in a staggered manner. It will be available also in a staggered manner. At the same time, the delivery mechanism will also need to be enhanced.
Okay.
So that's all.
If I can just add to that and take it across to Dr. Shekhar Mandid, Dr. Shekhar, does the fact that there may be a possibility that the vaccine needs 2 doses add to our storage and distribution challenge?
Yeah, indeed, it's challenging. But as Dr. Sinha correctly pointed out, India has had a very successful universal immunization program. Is one of the most successful countries around the world to have carried out this program. And therefore, there is an existing network. Although that program was targeted towards infants and all, but nonetheless, that has actually generated very good infrastructure in terms of distribution. Now, the 2 doses thing, of course, does introduce one more challenge, because we will actually have to get the people to get the second dose once again after a gap of 4 weeks. This is number 1. Number 2, of course, as you said correctly, the cold chain network and all, which exist to a large extent, but nonetheless, we'll have to make sure that is fairly robust across all over India. So these are the kind of challenges that actually what we have ahead of us. But I'm pretty sure, given the intent of the government and all the public services, this kind of challenge can be resolved easily.
Okay, let me in fact also ask Dr. Pujari. Dr. Pujari, would you like to add to this aspect about storage being a big challenge and how the states need to go about preparing it? Is it the state's responsibility, or does the center look at it?
So I think the cold storing facilities for current vaccination program are owned by the states. And and we have already a very strong network of state-owned cold chain for vaccines, and I think it provides location about 8 million locations that these vaccines can be delivered to. I would like to take it a little different as well, a little out of box thinking, because we need to scale up very rapidly, is to try and involve the private sector in administering the vaccine.
Okay.
Right now, the private sector is not really scaled up in trying to administer vaccine. But if the facility is 2 to 8 degrees, can we set up vaccination administration sites apart from the primary healthcare centers or government centers, even in the private sector? And I think public-private partnership may perhaps help in trying to scale and rapidly achieve these targets.
Okay, so in fact, I was going to the distribution aspect also. That was going to be our last point to talk about. Dr. Leria, would you agree that not just in creating the infrastructure part, but even in the vaccination aspect, perhaps the private sector needs to be brought in?
So, private sector has an important role in delivery of health services, or rather the vaccine production itself is an example of public and private partnerships. Most of the vaccines are being produced in private sector, and one of the India's leading COVID-19 vaccine is a collaboration between Indian Council of Medical Research and Bharat Biotech, which is a private sector. However, as far as delivery of vaccines is concerned, and especially in the COVID-19 vaccine, we know that a majority of vaccination in India is done by public sector, and public sector has really robust delivery system. Nearly 85 to 90% of all the vaccines in routine immunization program are from the public sector. On this point, I would like to go back to the previous question and then reflect on this quickly. That cold chain capacity and supply chain, there would be a number of consideration which include which type of vaccine is available. For example, India has a cold chain capacity for vaccines which has two types. One is for 2 to 8 degrees Celsius, which is majority of vaccine, but minus 20 degrees Celsius. Now, if a vaccine which country decide to use, it can be stored only on 2 to 8 degrees Celsius, which means that minus 20 storage capacity not useful. And then we need to scale up the 2 to 8 degrees Celsius cold chain storage capacity, or maybe because there is an existing minus 20 storage capacity, so then country can use 2 type of vaccines, and that will be optimal utilization of space. So there are a number of considerations, but having said that, and previous speakers reflected that country has a strong cold chain storage capacity. More importantly, it has strengthened or improved over last few years. And third thing is that though COVID-19 vaccination is going to be slightly different, that only adults or initially adults will be vaccinated.
Right.
But country has done a mass vaccination for polio immunization program, which is around 20 crore children are vaccinated over a short period of time, and they have stored the vaccine. So this is feasibility. And the final part, coming to the 2-dose schedule, though 2 doses is important consideration, but we also know that the entire supply would not come in one go. It will come in a phased manner. So once you use the initial available vaccine, then only the second vaccine will come. Final part, 2 things. Country has a cold chain storage system and capacity, but it need to be strengthened to prepare vaccine. Second and most important, it need to be strengthened in those areas and those states it is weakest. So we need to identify those setups because this cold chain capacity is not uniform across the country.
Correct.
So some of the states do not have sufficient capacity, and that's where attention should be given.
Oh yes, absolutely, and those are the things that we should be looking at right now. And keeping politics aside, the states and the center need to work together to identify what are weak points and start fixing those weak points as we wait, for a final decision on which vaccine and when it can come to our country. Thank you so much to all of you experts for joining us on this conversation. It's been a very enlightening conversation, and I hope it helped our viewers also understand this a little bit much better. Like our experts pointed out, it's looking like a case of serendipity, that it wasn't planned or by design, but effectively what Oxford AstraZeneca ended up doing was giving half doses to a percentage of their volunteers, and that dosage regimen has actually shown better results. Viewers, even as the companies do their job and the experts and the scientists do their job of finding us the right vaccine, we have to prepare, and our governments have to prepare how they're going to get that vaccine for us. Yes, we have a basic skeletal system in place, but for the COVID vaccine, we need it to be faster. We need it to go out to a lot many people. It's not just children or infants or pregnant ladies, but a large percentage of our population would need to be vaccinated, which is why this is going to be something completely different from what anybody in this world has seen. Thank you so much for joining us on that conversation. I have another expert joining us right now, Dr. Jayaprakash Muliyal. He is an epidemiologist, and he's also the chairperson of the Scientific Advisory Committee of the National Institute of Epidemiology. Dr. Muliyal, a very basic question that, to begin with, many of us are wondering what level of efficacy generally works. We are seeing all these announcements of 90%, 91%, 94% efficacy. What's the norm so far for the vaccines that we have?
Well, any protection will be desirable. Less than 50% protection will be very, very poor vaccine. We are looking forward to something that is above 90%. But when you say 90%, you have to understand the meaning of the word 90%. It means that your serious illness in the vaccinated will be less by 90% as compared to a placebo. So we are actually looking at bad outcomes or death. Death may not be there because the study sizes are not ever so large. At the same time, serious illness, pneumonia, hospitalization, that's what we want to reduce. And that's the protection we require.
Okay, fair enough. So let me ask you this then. Should we also be looking at more than one options? Is it simply going to be a case of whichever vaccine gets announced and approved first is the one we only use, or should India be looking at using more than one vaccine?
We need to, because basically this is the way you should think. Number one, what is these vaccine made of? They are made of a target protein or something that can stimulate the production of the target protein, which is called a spike protein. That is coming from the infectious virus. We have isolated it from it. Now remember, this particular bug causes very good immune response. In fact, people who had the disease or infection should have lasting immunity. There was some doubt about it earlier, but not anymore. Consequently, the vaccine produced against this particular protein should also be good, regardless of which platform they use, in my opinion. Now remember that it is not the work is done by our body, the human body, whether it is the virus itself or the vaccine, we have to respond. And that antibody production will be technically similar regardless of what vaccine you use.
Okay, the conversation we were having before you joined us, Dr. Mulyal, was also about how well is India prepared. A lot of what we're seeing right now is about our own preparation. Now, while we do have an immunization program which is active for several other diseases, it's obviously not of the same scale. And we have a big population, a large population. Is India really ready for that kind of an immunization program then?
Yes, but I think what happens is that there's no vaccine really ready to use tomorrow, because we have to prove they are effective and prove they are safe. So there is a lot of caution that goes behind all this planning. Now, mass vaccination is unlikely for us because we would like to prioritize the groups which need to protect. And you know, elderly and those with comorbidities. Also, people involved directly in caring for COVID patients or those who are trying to control the disease. Now, all these are priority lists and we have to do it systematically. Remember, these are all new vaccines and we have to keep watching for signals for any danger. All these steps will help in creating a situation where we are aware, we are safe, and people can take the vaccine.
All right, Dr. Mulyal, thank you so much. Really appreciate you taking the time out and speaking to us here on Mirror Now. So viewers, there you've heard it from a wide range of experts specializing in the field of vaccination and immunization, telling you that one, we still don't have a vaccine yet, but it is very apparent that in the next few months we will. Two, even then we should move forward with caution. We can't base our choices only on the press releases being handed out by the pharmaceutical companies, the research companies right now. The detailed data has to be analyzed, studied. Our own tests have to be done. So even when we do decide on a vaccine and start putting it out, we will have to try it out and test it to see how it's working on Indians. Then we have to very closely track for side effects. We have to right now keep reminding our states and the central government that they need to prepare a large-scale, giant infrastructural program and set up for the transportation, storage and vaccination when the vaccine is finally here. It's a big task and it has no space for any kind of bickering, political egos or any kind of otherwise state versus center politics. And we hope our political parties recognize that. Thank you so much for joining us.